see Sean, who isn't feeling well, trying to wait for the elevator. But because it was taking too long, he decides to take the stairs down instead. As you can see, he isn't wearing a mask and is constantly coughing on his hand. As he walks down the stairs, we can see him holding onto the railing with the hand that he has coughed on. Scene 2. On this scene, we see Iman walking down the same stairs and touching the railing that was contaminated by Sean. Scene 3. Now on this scene, we see Iman continue to spread the contamination on the railing going down the stairs. Here, she even went to greet Husna, her classmate, and proceed to give a high five without knowing her hand is contaminated. Scene 4. On scene 4, we see Sean continue to cough on his hands as he walks into the stationery shop and even proceeded to touch the door handle of the shop. Now, we see Aina, another victim, touching the door handle as well. Aina is browsing through the snack aisle, touching all the snacks with her contaminated hand. Now, other innocent customers who decides to buy the snacks will be infected too.
Hi, I'm Raina Binti today. So we will talk about occupational disease. So coughing without covering your mouth can potentially spread a variety of disease, but it is important to remember that not every cough is necessarily indicative of infection illness. So there are some diseases that can be spread through respiratory droplets, which is a first common cold. This is the most common infectious disease spread by coughing and sneezing. So the other symptoms is runny nose, congestion, sore throat, and mild cough. And then next, flu. This is a more serious viral illness than a cold with symptoms like fever, chills, muscles, itches, fatigue, and cough. And then next is COVID-19. This is highly contagious viral disease, can cause fever, cough, shortness of breath, fatigue, and loss of taste and smell. And then RSV. This is a virus, can cause mild cold-like symptom in adults, but can be serious to the infant and young children. And then next is measles. This highly contagious disease cause fever, rash on skin, coughing, and runny nose. And then next we go to the other disease can caused by coughing, which is pneumonia. This is infection of the lung, can caused by bacteria, virus, and fungi, and it is caused by fever, coughing, shortness of breath, and chest pain. And then meningitis. So this is inflammation of membranes surrounding into the brain and spinal cord, and can be caused by bacteria or virus, and caused by fever, headache, stiffness of neck, and rashes. So it's important to remember that this list of not exhaustive, and there are many other diseases that can be spread through coughing. So if you're concerned about your health or the health of someone around you, so it's always the best to consult a healthcare professional for diagnosis and proper treatment. So we go to the next.
Hi, I'm Nur Hidayat Husna from Occupational Therapy. In this video, I will explain hierarchy of control based on the video we record. The first hierarchy is contamination, where the university will temporarily close to prevent the spread of disease and protect the campus community. Isolating individuals who are infected to prevent the spread of the disease to others. Quarantine measure will be taken to individuals who have been exposed to the infectious agent to prevent potential transmission. The second one is substitution, where transition to remote or online learning to reduce in-person interaction, especially during peak periods of infection. And then implement a hybrid model with a mix of in-person and online classes to reduce the number of people on campus. The third one is engineering control, where it will improve ventilation in the indoor spaces to reduce the concentration of airborne particles. Install barriers such as plexiglass in areas where maintaining physical distance is challenging, such as at the service counter, classes, and cafe. Individuals also are advised to keep a distance of at least 6 feet from others who are not from their household. This will help to reduce the risk of respiratory droplet reaching others when a person coughing or sneezing.
Assalamualaikum, my name is Nuriman Najha, and today I will be explaining the hierarchy of control. First things first is the administrative control. Firstly, for administrative control, the company can develop a workplace policy or procedure which includes policies and procedures for sick leave, quarantine, isolation, physical distancing, mask wearing, and hand hygiene. Secondly, by encouraging workers to work remotely or develop a flexible schedule, which the flexible schedule can help stagger shifts and reducing density of workers on site. And third is health monitoring and screening. The company can implement a regular health checks, temperature screenings, and symptom monitoring. The fourth one is facilities management. The company can increase the cleaning frequency and ensuring adequate supplies of sanitizers and cleaning materials. And lastly, communication and signage. For example, maintaining clear and consistent communication to remind employees of safety protocols or mention or inform workers if there is any changes in the policies and updates on the situation. Lastly, there's personal protective equipment, also known as PPE. The first personal protective equipment is the mask, which can be used to reduce transmission of respiratory droplets that may contain the virus. The second one is face shields, which is usually used in conjunction with masks to protect the eyes, nose, and mouth from droplets and splashes. And lastly, the third one is the gloves, which can prevent direct contact with potentially contaminated surfaces. That's all from me.